Hello, welcome to the Pediatric Hotline. Today's presentation will cover cough. I would really appreciate it if you would give me a thumbs up and consider subscribing to my channel. Thank you. A cough occurs when something irritates the throat, which triggers a response of the airway to cough to eliminate or expel the irritant. A cough is not a disease, but rather a symptom of an illness, irritant, or an inflammatory state. In healthy children, cough most frequently accompanies a respiratory infection such as a cold, pneumonia, COVID, flu, among others. A chronic cough can be due to disorders such as asthma, sinusitis, allergies, or reflux. Other causes include choking, inhaling something irritating, or habitual coughing. An acute cough from a respiratory infection usually resolves on its own, but the cough may linger for an additional 1 to 3 weeks after the infection is over. Chronic coughing is more long-term, and you may need interventions such as inhalers or other medications to control the underlying disorder. Coughing from any condition is usually worse at night, and children sometimes may vomit with coughing. There is no cure for a cough except to treat the underlying disorder. However, there are some things you can do to help control the cough. For an acute cough, a humidifier in a child's bedroom at night. For children over 2 years of age, a teaspoon of honey at bedtime is excellent for a cough. Make sure they get plenty to drink. No caffeine, it's dehydrating. No dairy or beverages with added sugars because it makes more mucus. Suction the mucus out of the noses of infants and toddlers. They tend to swallow their mucus, which can make them vomit. So if you suction their noses out, they won't have as much mucus. The American Academy of Pediatrics does not recommend cough syrups or decongestants for children under 7 years of age due to potential neurological side effects. For a chronic cough, you can use any of the recommendations from the previous slide and make sure to utilize any prescriptions as directed, such as albuterol, Flovent, Pepcid, allergy medications, etc. It is very important to call your pediatrician immediately if you have run out of prescription medications. Avoid known irritants such as smoke, pet dander, dust, or spicy foods. So when is a cough worrisome? If the child is coughing so much that they turn blue or pass out, or their asthma cannot be controlled by their prescription medication. The cough is accompanied by difficulty breathing, as demonstrated by fast breathing, or grunting sounds, or you may see their abdominal muscles or ribs suck in when they attempt to breathe. For any choking event, when the child is unable to expel the object or the food that they choked on, or if they've developed trouble breathing or turned blue, have a fever, or continuously cough after the choking spell. As always, all concerns or questions should be directed to your pediatrician. That'll do it for today's presentation. Thank you for watching the Pediatric Hotline. I hope this was helpful. If there are any topics you would like to see covered on this channel, please comment below. Have a healthy and wonderful day.